Hello everyone, my name is Stephanie and I'm here to talk about institutional racism towards Aboriginal and Torres Strait Islander community and its impacts on the health outcomes. I will walk through the key areas that will be covered within this presentation. Firstly, I will begin by introducing the health disadvantages, following with an explanation of institutional racism within Australian hospitals. Then discussing the role of both nurses and midwives in the issue, and finally identifying strategies that will be implemented within the healthcare environment. Aboriginal and Torres Strait Islander experience many negative encounters, especially within the healthcare system. Both social and mental well-being are affected due to impacts of colonization, loss of land and cultural identity, intergenerational trauma, racism, and discrimination. Together, these factors contribute to difficult access to healthcare in both physical and mental well-being. Research shows that many Aboriginal and Torres Strait Islander people have a higher rate of developing chronic illnesses such as hypertension, cardiovascular diseases, and diabetes, which will result in lack of health outcomes. In the case of John, it shows that how dangerous the healthcare environment can be. As John is an individual of the Aboriginal and Torres Strait Islander community, he presented to the emergency department with chest pain and waited 1 hour before being triaged. Then was assigned to a nurse who shared discriminatory opinions, which led to John rejecting any further treatment, regardless of his medical condition and history. This shows the lack of cultural respect and racism towards Aboriginal and Torres Strait Islander people, especially towards men, within this research that was conducted by Hagi and team. This study shows that there is a higher level of discrimination experienced by men than women in comparison to non-Indigenous Australians, which leads them to poor mental health and refusing services. Individuals from the Aboriginal and Torres Strait Islander community have faced many negative experiences, especially racism within the healthcare setting. Bess has stated that people of color experience racism, which takes a mental toll to the people as well as society. Therefore, Aboriginal and Torres Strait Islander people who experience racism within the healthcare community can discourage them from seeking medical assistance, which then leads to their health to worsen over time. Australian Institute of Health and Welfare has shown that Aboriginal and Torres Strait Islander experience a high level of disease that is 2.3 times greater than the ones experienced by non-Indigenous Australians. This results in members of the Aboriginal and Torres Strait Islander community experiencing a serious amount of health disadvantages when compared with non-Indigenous Australians in areas like life expectancy, chronic illnesses, mental health, and healthcare access. As the Aboriginal and Torres Strait Islander have health differences compared to non-Indigenous Australians, it is not biological, as factors such as intergenerational trauma, colonization, racism, and discrimination are heavily influenced. Research conducted by Hedges and team supports this by stating racism in both institutional and interpersonal circumstances within the healthcare community will result in an ongoing poor health outcome, which will also reduce the accessibility for Aboriginal and Torres Strait Islander people, along with a limited culturally safe care. Nurses and midwives play a crucial role within the healthcare system. By addressing the issue of racism and discrimination, it will lead to a positive outcome for individuals from the Aboriginal and Torres Strait Islander community. In the case of John, the nurse made a comment that has created a culturally unsafe setting, which made John refuse any treatment despite his health condition. A research has shown that racism in the healthcare environment contributes to unequal health results, along with discouragement to seek help for the First Nation peoples. Both institutional and interpersonal racism has been shown over the years towards the Aboriginal and Torres Strait Islander people, making it have barriers to access healthcare and resulting in poorer health outcomes. In order to address this issue with John, the nurse should have acknowledged his concerns with an appropriate response regarding to his condition, such as explaining the process of treatment. This will make John feel culturally safe and ensure that he can trust the healthcare workers. Gariri has stated that by building trust and culturally safe setting will have better accessibility for healthcare for Aboriginal and Torres Strait Islander peoples. To address the issue of institutional racism, there are strategies that must be carried out in order to succeed for a positive outcome. One strategy is to provide mandatory training about cultural safety and anti-racism for all healthcare workers. Best has demonstrated that providing education will support the quality of healthcare as well as cultural safety and competence will be promoted. Research has shown that programs that focus on culturally safe leadership for Aboriginal and Torres Strait Islanders are essential, especially to the healthcare workers as addressing systematic inequalities involves models who are self-determined will strengthen leadership. Another strategy is to increase healthcare workers from the Aboriginal and Torres Strait Islander community to represent and lead within healthcare organizations. By encouraging Aboriginal and Torres Strait Islander peoples to an inclusive approach through leadership, it will reduce workload on healthcare workers while improving the environment within the healthcare system to a culturally responsive to Aboriginal and Torres Strait Islander communities. Therefore, the strategies that have been mentioned will improve the healthcare system through staff education programs and leadership initiatives, which will promote respect, equality, and making the environment culturally safe. Thank you for listening.